Arthritis is incredibly common, with 1 in 7 Australians reported to having a form of it. So it could be a great cause for pain and discomfort. But how much do we know about it? We're going to learn more today. So tell me, Cassandra, what is arthritis?
Yeah, arthritis is a term that involves lots of different types of arthritis, lots of different types of conditions. So the 2 most common arthritis that people tend to know is osteoarthritis, which is a wear and tear arthritis, and rheumatoid arthritis, which is a more systemic arthritis that affects not just the joints but the surrounding tissues as well. But there's juvenile arthritis, there's septic arthritis, there's I think there's almost 100 types of different arthritises, but they all will affect the joints in some capacity. So if we're looking at, as I said, probably the most common type of arthritis is osteoarthritis, and that's our wear and tear arthritis. That's our getting older arthritis. That's our degenerative arthritis. So what happens is that over time, the bones, which are normally separated by cartilage, which sort of acts as a shock absorber and lets smooth movement through the joints, over time that's worn down, and suddenly you get this effect of bone essentially rubbing against bone. And that makes changes to the joint surface that can cause inflammation, so hot, painful joint, and also can cause pain from just that bone grinding on the bone. It can then affect movement because that smoothness is gone, so we get quite stiff movement, and disuse, reduced strength. The list goes on with sort of
delightful, isn't it?
with how it can affect. And then there's other types of arthritis which isn't from wear and tear. It can be that suddenly someone wakes up with this really swollen finger or really swollen multiple joints, and that can be an arthritis that's caused more from issues in the blood, like some sort of disorder essentially of the blood, and that requires often a lot of testing to determine what the cause of it is. And why that particular person has got this type of arthritis, and so the treatments do vary in terms of what the cause of the arthritis is, particularly if it's not the wear and tear type.
So tell me, who can get arthritis?
Well, anyone can get arthritis, particularly the wear and tear type. Like essentially everyone has arthritis at some point in their lives, if they're getting older. But what's interesting with arthritis is that it affects different people. So you might have one person who's got this really knobbly, crooked hand, and you'd think they would be in a lot of pain, but actually they're not, versus someone else will come in and they'll have just a tiny little bit of changes in their joint, but it's really painful. And so everyone can get it, but it will affect different people a little bit more. And it will also affect people differently because of how they use their hands. So for example, a musician is going to notice they've got arthritis a lot earlier than someone who needs their hands to be so dexterous. So it does depend on, as I said, different types of people, but also the effect of arthritis will really vary depending on what people rely on for their hands.
Because you can get it quite young too.
Well, you can get it from childhood age, but you can also get it you can't get it super young from a degenerative point of view. It's very rare that we'd see anyone under 40 with arthritis. You might get more an overuse of a joint and that sort of the precursor to arthritis in someone quite young, but tends to be people over 40 who will start to notice that more, the degenerative wear and tear style.
I can't wait. It sounds just delightful.
I know, getting old sounds amazing. All my patients are always like, just don't get old.
Perfect.
That's great advice, but I'm not sure how to action that.
So that's my next question. How do you help with the treatment of arthritis?
Yeah, so there's lots that we can do, and there's actually so much research and things going into learning a little bit more about how we can treat arthritis, because we definitely always used to treat it very much treating the symptoms rather than trying to prevent the symptoms happening. So that's still a really important part of what we do. So if someone comes in with a painful joint, then we've got lots of different ways to reduce the pain, protect the joint, educate them on what they can, can't do. But now we're finding that if we can get someone quite early on, and that we can provide them with the exercises to ensure that they maintain their movement, but also teach the hand muscles to work in such a way that we actually protect that particular joint, then we can actually prevent or really push back the timeline of when that arthritis starts to be a real problem.
So there you have it. It's very prevalent. Don't age. All of you, just stay young forever. But if you are suffering, you don't need to suffer in silence. So understand that treatment options are available. So don't hesitate to get in touch with the friendly team at Helping Hands today. They would love to help you.